Jones. I'm Nikki. I'm going to be the RN and I'm going to do a physical assessment on you today. Could I just get your first and last name? Okay. Information was correct. Pull the curtain for privacy. Mrs. Jones, can you tell me why you're here today? That's correct. Can you tell me where you're at? That's correct. And could you tell me the date today? Okay, good. Everything is ×4, orientation ×4. I'm just going to take a peek into your eyes, all right? This is going to be your neuro assessment. Pupils are now at a 5. If my patient had a history of seizures, I would not be doing this on them. All right, just take a peek at my nose while I check your eyes. Good. All right, and they constricted to a 3. Could I just have you watch the end of this pen light without moving your head, just your eyes? Okay, when it comes close, watch. There you go. Okay, Perla is noted. Looking in the mouth and nose. All looks well. Could I just have you squeeze my hands, Mrs. Jones? Perfect. It's the same on both sides. Push up. Good. Down. Good. It's 5 for motor function of the upper extremities. Okay. Can I have you push against me? Good. Good. And it's 5 for lower extremities. And I'm just going to check a little bit for nuchal rigidity. Okay, no pain noted. That is good. I'm just going to check your reflexes, okay? So I just need you to relax. Here I will do the tricep. Positive, which is good. Bicep. Positive, which is good. Radial brachial. Positive, which is good. I would do this bilaterally. Do you help me set it up? Okay. Good job, Mrs. Jones. Just gonna check her patella reflex. And again, I would do these bilaterally. And I'd watch out because I don't want to get kicked. Okay, positive. Achilles. Positive. I'm going to check what's called the Babinski's. Mrs. Jones, I'm just going to run this on the bottom of your foot. It's not sharp or anything. It might tickle, okay? Good. Negative, which is what we want. Okay. And I do want to note that my patient was alert and awake as well for their LOC and mental status. Okay. Next, I'm just going to listen to your lungs, all right? May I expose your chest so I can see everything? Okay. Okay, I'm going to put this down just a minute. Okay. So here I'm just noting her rate and rhythm while she's breathing. Tracheal is midline, which is what we want to see. I'm looking to see if she's using accessory muscles. She's having difficulty breathing. Her 2-to-1 ratio is what it should be. Noting any abnormal pulsations at this time as well. And that would be for my heart, but I'm just noting it all now while she's exposed. I'm just going to take a listen. So every time I touch my stethoscope to your skin, could I have you breathe in through your mouth and out through your mouth? Clear? Clear? Clear bilaterally? clear. 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 And Jarvis says not to do this, but for this, I will be percussing on her chest, and this will be in the same spots that I listen to. Mrs. Jones, I'm just going to have you roll onto your side so I can listen to your back, okay? Okay, again, Mrs. Jones, could I have you breathe in through your mouth and out through your mouth when my stethoscope touches your skin? Okay. Clear. 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 Now I'm going to percuss her back. I'm going to percuss in the same spots I listen to, and this will be intercostal. And I want to hear a resonance. Good. I'm also checking. Okay, sounds good. Expansion is normal and it's symmetrical. Everything was clear. Your lungs sounded great. If I did hear any adventitious lung sounds, I would check for egophony, and I would check for tactile phrenitis. Mrs. Jones, I'm now just going to listen to your heart. Is that okay? Okay, good. Again, looking for any abnormal pulsations, any bruising, anything that is out of the ordinary. First, I'm going to listen to what's called your carotid artery. So I'm just going to have you turn towards me. At this time, head of bed 45, I'd be looking at the jugular vein as well for any distension. Turn it to the bell. I'm going to have you take a deep breath in and hold it, okay? 1, 2, 3, deep breath. Good. No brewery, which is what we want to hear. Okay. There you go. I'm just going to take a listen to your heart, okay? Suprasternal notch, angle of Louis, second intercostal left, going to be your aortic. S1, S2 heard, no murmurs, rate and rhythms normal, straight across, second intercostal, left side, that's going to be your pulmonary. S1, S2 heard, no murmurs, rate and rhythm normal. Third intercostal is going to be your herbs. S1, S2 heard, rate and rhythm normal, no murmurs. Fourth intercostal, tricuspid. S1, S2 heard, rate and rhythm normal, no murmurs. Fifth intercostal, midclavicular. Excuse me, ma'am. This is going to be your mitral valve. This is also where you listen for 1 full minute for the apical pulse. And that is S1, S2 is heard, rate and rhythm normal, no murmurs heard. And also in the same spot, if I wanted to check PMI, which is enlargement of the heart, I would just press with my thumb into the intercostal space, fifth midclavicular, and feel a pulsation there. Okay, I'm just gonna check for your pulses around your body, okay, Mrs. Jones? So we're in temporal, 2+, Good. Carotid. 1 at a time. 2+, which is good. Brachial. 2+, good. Radial. 2+. Ulnar. 2+, good. Sorry, Mrs. Jones, I'm just gonna have to expose you just a moment. I'm gonna check your femoral. 2+, good. Thank you. Popliteal, 2+, 2+. Posterior tibial, 2+. Dorsal pedis, 2+. And while I'm doing this, I'm gonna assess her skin. It's warm and pink, which is good. She doesn't have any hairlessness, any ulcers, any discoloring, any bruising, anything like that. No edema, so that's all good. Cap refill, less than 3, that's what we want. No discoloration. Cap refill, less than 3, no discoloration. There's no clubbing of the fingers, no swelling. Her skin is pink and warm. All right. Now, Mrs. Jones, I'm gonna take a listen to your stomach, okay? Do you have to use the bathroom before I do this? No? Okay. I'm gonna put the head of the bed down. So she's flat. Okay. And while I have her flat like this, I could stand at the end of the bed, expose her stomach, and I would have her cough. This is just to check for any hernias that she might have. And are you in any pain right now, Mrs. Jones? No? Okay. If she were in pain, she might be having appendicitis. So at that point, there's a couple things that you can do for that. First is Murphy's sign, where you press on the side. And if there's rebound tenderness, that would be one of the positive symptoms. And the second thing you could do, raise her right leg if there's pain. That's another positive sign. But for this assessment, the patient states that they are not having any pain, so we will do a normal assessment. First, I'm looking, making sure that there's no abnormal pulsations, there's no bruising. Everything looks good. Her stomach is flat, nothing abnormal. Good. I'm just going to take a listen to your stomach now, Mrs. Jones. Okay. And then I would do the 4-quadrant. If my patient had issues with the GI tract, I would do the 9-quadrant to do a more focused assessment. I am listening in each quadrant 3 times. And I am noting that there is activity in each quadrant. Good. Everything is normal. Okay, so now I'm going to palpate. I'm going to just touch her stomach, and I'm making sure to watch her face to see if there's any pain. Mrs. Jones, if you're having any pain, please let me know. No pain noted. Good. And Jarvis tells us not to percuss on the abdomen, but for this, I will be doing this example today. I want to hear timpani, except for in the very top of the right upper quadrant. It's going to be a little dull because that is where your liver is located. But I'm going to percuss where I've listened. Good. Timpani throughout. Good job. Is there anything else that I can do for you today, Mrs. Jones? Head of the bed up. Make sure she has her call light. Everything looked really good? Is there anything else you need from me? No? Okay, perfect. Well, thank you so much for your time. And that is my full assessment.